Good morning and welcome to the IDC Digital Innovation Connection, also from my side. It's a real pleasure to be here. My name is Giulia Besana. I'm a research analyst at IDC Health Insights Europe. And today I'm going to introduce you the concept of priming the healthcare next normal. This presentation is really intended to offer an opportunity to look away from the current pressures just for a moment and think about the future, not only in terms of returning to the same level of activity and the normality we were used before January 2020, but also as a chance to write a new chapter of healthcare digital transformation, or as we call it, to prime the healthcare digital transformation next normal. In the last months, our work as a team has been strongly focused on looking closely at the industry to understand where European healthcare organizations are right now in their journey to the next normal. So whether they are in the early response mode, focusing on reacting fast to the immediate pressures and adding more capacity to absorb the spikes in demand, whether they are looking at stabilizing the organization, focusing on returning to normality while looking at the second wave of COVID-19, or if they are in the process of figuring out what are the lessons learned from January up until now and how those can help reimagining the organization and accelerate digital transformation. Or if they are already looking at bringing innovation up to scale and fundamentally reshape services provision. So in the early response, most healthcare leaders have assembled high-functioning teams to respond to the immediate crisis. They have been adding capacity and capabilities to make their organizations more resilient and possibly preparing for returning to a more stable levels of activity, while also monitoring the second wave that we are facing right now. Many leaders now are beginning to recognize the importance of reimagining patient services and ecosystems, accelerating transformation. And this all is to bring at scale innovation that will fundamentally reshape health. However, many organizations still need to further increase their resilience in order to return to normal levels of activity. As the example from Italy and UK that you can see here, healthcare organizations are dealing with backlogs, are clearing waiting lists, while at the same time pressured to deal with the second wave of COVID infections. So, if there is any first lesson to learn, it is that healthcare will be dealing with uncertainty for a while. And this means that it is necessary to rebound and remodel how organizations and healthcare providers work. In all of this, digital is a key element in this reforming action, as long as its role is defined along some of what we define the fundamentals of the healthcare practice that we summarize here in the acronym PRIME, where the P stands for purpose, a purpose-driven organization that recenters on patient health needs, and an organization that respects individuals' information rights to drive trust, and at the same time takes into consideration patients' differences to drive inclusiveness. So inclusiveness is really around accelerating innovation, but without leaving anyone behind. This is possible only in an organization that has a workforce with a high level of mastery of insights to support complex decisions and workflows. And all of this is underpinned by an agile digital infrastructure that, of course, must drive efficiency further. So I know it looks a lot to digest, so let's start with purpose as the first fundamental point to prime the healthcare next normal. Purpose for healthcare is really about maximizing patient value. Value can be described as outcomes that a patient experiences. Healthcare organizations therefore need to understand and act upon this value creation process along the whole patient journey. This implies a 360-degree view of the patient, or as we call it, a patient of one vision. So this patient of one vision allows to personalize services for improved experience, as well as to integrate these services for improved efficacy and efficiency. The impact of digital solutions should be measured in strong connection with this vision. Nearly 46% of healthcare providers in Europe have introduced new KPIs to measure the performance of technology, which means, for instance, that they are measuring how patient-facing solutions improve choice, how they improve convenience, and of course, adherence to treatment, which is key for patient outcomes. This patient of one vision is highly dependent on trust that can be there only if there is respect for patients' rights. And here we go to the second point. To do that, we need to level up the conversation on information governance from what we have as a strict play on compliance and data security to one that creates strategic relationships that are ethical and transparent within and outside the organization. So trusted governance really removes the fear of innovation. And this is because stakeholders of the ecosystem become more and more aware of risk and of how to mitigate it when they share information and data with other organizations. So leveraging trusted governance and trusted ecosystems is essential to strengthen the relationship with patients, especially today, with a boom of fake medical news and episodes of unethical and biased use of technologies, such as artificial intelligence. So what should CIOs do? Healthcare CIOs need to really assemble the necessary digital infrastructure, data, and processes, and work closely with a line of business executives to support personalized reach, where patients are much more in control and, of course, much more engaged. So we have seen how purpose and respect contribute to creating empathetic digital experiences that are inclusive because they address patient concerns. With the COVID-19 outbreak, digital services quickly became a core part of the response. Telemedicine in particular has seen an incredible acceleration, and at IDC we're expecting an enormous growth of investments in this area. There is, however, the fear that this acceleration means excluding some part of the population because of the well-known digital divide. So it's a fair concern, but we need to look at it from a different perspective. These technologies extend the reach of healthcare professionals. They enable some level of self-services for patients. And this, of course, allows to free up resources that can be dedicated to other patients that cannot use these services, maybe elderly people or people who do not have access to digital solutions. For instance, Suve, the example that you can see here, is a chatbot that helps Estonian citizens to find basic information about the coronavirus situation that has helped to keep emergency phone lines free for those most in need. And also we need to remember that telemedicine is not a one-size-fits-all, and that it must be adapted to different needs, even for complex patients. For example, the sarcoma unit of the Royal Marsden converted 75% of their planned face-to-face appointments to telemedicine. And this has brought great success and high satisfaction rates. And patients wanted telemedicine to be part of their future care. So It is really a way to support operational resilience, to respond to business disruption with agility. Virtual care services, however, cannot drive agility without an organization able to master insights and embed them into the workflow and relationships. The crisis has forced to revisit healthcare traditional models of work. Collaboration has been accelerated, and organizations have been using data more extensively to empower the workforce in real time. Here you see the example of Poliambulanza. Poliambulanza is one of the largest hospitals in Brescia, Italy, and they used the enterprise analytics to guide all the decisions of their crisis unit. The hospital collected, analyzed, and shared data to provide insights and continuously learn about what was working, what was safe, and what was needed. Really, the value of data is in the decisions it enables and in being embedded in the workflow that supports the process. Healthcare CIOs need to address the inability to access data by working on data infrastructure and intelligence solution, as well as by understanding the workforce information needs in a much more granular way. An agile, insights-driven organization must be matched with an efficient technology infrastructure. Almost half of healthcare organizations we interviewed recently told us that they are adding new IT projects where the pandemic has revealed weaknesses. Legacy infrastructures and applications have been a major barrier to the transformation of healthcare. European healthcare organizations are looking to deploy hybrid cloud, and they're looking at really extending their on-premises infrastructure for greater business continuity through automation and orchestrations of resources. But they're also looking at cloud to support new data consumption models and, as we have seen, to allow rapid yet coherent adoption of new applications, thus reacting much quicker to the unexpected changes in demand. So, to summarize, really, the next normal for healthcare is driven by the purpose of maximizing patient value based on the respect of the broader spectrum of individual data rights, enabling trust in ecosystems and services. Services that are inclusive, because of course the right channel is used with the right patient at the right time. These patient services are combined with a healthcare workforce that has a high degree of mastery of insights to support decisions and to automate workflows. Resilient, modular, and highly automated infrastructure ensure overall efficiency as they allow to align with changing business objectives in a much more sustainable way. These pillars will really prime healthcare for the future. A future where hopefully we will wear less masks, but we will also be ready to write the next chapter of innovation. This is the end of my presentation. Thank you very much for your attention.